Thank you, Devin, for the warm weather up ahead. But according to the Pulmonary Fibrosis Foundation, more than 250,000 Americans are living with pulmonary fibrosis and interstitial lung disease. Oh, goodness.
Good job. You did it.
Quite the mouthful there.
Yes.
Here to tell us how to identify symptoms and say some words and when to seek help is Nurse Christina Paris from the VA. So thank you so much for popping in today.
Hi, good morning. Glad to be here.
Yes, thanks for coming on in. And we're excited to learn all about what is pulmonary fibrosis.
Yeah, so it's a lung disease, like you said. So there's more than 200 different types of lung diseases. And what happens with pulmonary fibrosis is, and I was showing Michael before, but so if you think about, this tissue, it's very thin.
Right.
It doesn't take much. So our lung tissue is that way. Good, healthy lung tissue is very thin, and so blood vessels are right there next to it. So as we breathe in oxygen, it can go into our lungs and then go from our lungs into our bloodstream, which then circulates to all of our cells. This is great.
So it's easy to transfer through.
It's
nice
easy to transfer through.
Gotcha.
So when we have lung disease, like COPD, pulmonary fibrosis, asthma, things like that, your lungs can get a little more damaged, or you can have a harder time. So if you think about this, pulmonary fibrosis is scarring. So, when you cut yourself and you get a scar and it kind of builds up more layers than normal. So same thing, it's still flexible, but it's not gonna expand. Things aren't gonna go through as easy as normal healthy tissue.
Kind of reminds me of like a clogged air filter.
Yeah,
You're still gonna get something through, it's just not going great.
Right, and when you can't breathe, I mean, it's scary, it causes anxiety, and it's just not healthy for your body.
Yeah, so what are some symptoms that could indicate lung disease in someone?
So people are gonna have, of course, shortness of breath. You're not gonna be able to take in a deep breath. You might have a dry, hacky cough. Maybe you're having shallow breathing because you can't take that deep breath, so you're gonna kind of like be panting. You might have weight loss, because believe it or not, the more you have to work to breathe, that's a lot of energy you're consuming. You're also, when we breathe out, we lose water droplets so you can become dehydrated too. Clubbing, that's when your fingernails get kind of funky crackles or sounds that you can hear in your lungs when it's not, really opening up good and air.
Like noises you don't want to hear.
Right, exactly.
So if we have some of this and we're diagnosed with it, what's some of the treatment options here?
Sure, so they'll have you do a pulmonary function test. They'll maybe check your oxygen levels, tissue samples, CT scans, things like that. But oxygen therapy, there's a lot of inhalers, things like that, medications you can use. And sometimes people for really bad interstitial lung disease might need a transplant. They can do lung transplants as well. And just symptom management. So, using your inhalers, staying healthy, going through your pulmonary rehab, things like that. So all of those things will help you. Don't smoke. It's staying away from environmental. If you work in an area where you're going to smell a lot of gases or dust from things that just aren't good for your lungs, you want to make sure you're wearing your respirators.
So there are some ways you could at least try and help avoid it. Yeah, but really a lot of that smoke and
right.
Like
or if you're a mechanic, you're indoors breathing.
Yeah, just bad particles.
Right.
Preventing them from being around you into your lungs.
Well, fantastic. Just keeping on top of things, being preventative and asking questions when you need to.
Absolutely, and go see your doctor if you have any questions at all.
Yes.
Well, fantastic. Thanks again for coming on this morning, Nurse Christina. We appreciate it as always.
Yes, thank you so much.
You're welcome.
And coming up, we have what's trending